KICK, your #1 station for healthcare news. I'm Molly Kaufman, bringing you your evening news. Tonight we have a very special broadcast coming to you live from South Dakota State University. Brittany Decker will be coming to you live on site, where she is with two very special young gentlemen who will be discussing and performing an important aspect to nursing care, the handoff. Take a look.
Welcome everyone. I am Brittany Decker and I am here with KIC Television News Station. Today is the day we have all been waiting for. We have the Jacks here with us and they are going to be performing Perfect Handoff. Not to mention Jayco's here watching, so please stay tuned to see what we have to show you. I hope you guys all got your tickets because this is the moment that we've all been waiting for. The Jacks, they're about to come out and show us the perfect handoff.
I'm sexy and I know it. I'm sexy and I know it.
Welcome back everyone. Today I have the privilege of meeting with Aaron Schmidt, one of our Jacks that's competing in the big handoff today. Aaron, I have a few questions for you. Would that be alright?
Oh yeah, sure, yeah.
Alright, perfect. My first question is, how do you feel about the big handoff?
Oh man, it is such a privilege. You know, this is such a privilege. I just can't tell you how much. But the big handoff, it's a big deal. Man, you have to be organized. When you're coming on to the next shift, you have to be organized to talk to that nurse. That's the biggest thing. That is the #1 thing you have to be focused on. And there's lots of ways to be organized. Some people use a head-to-toe assessment. Sometimes at the hospital you work at, they have a flow chart and you can follow that flow chart. My favorite way to stay organized is a head-to-toe assessment. And as a nurse, everyone is familiar with a head-to-toe assessment. So you start with the head and you go through your whole assessment as if you were assessing the patient and you tell the other nurse what the assessment was all about. So what I like to start with is their name. It's good to have a name and it's good to know their name. It's good to know if they're a male or a female, and their age, and their doctor, so you can call them on the phone if you have any questions. I mean, that is huge. It's also good to know what they have, their diagnosis. Without their diagnosis, what are you gonna do for them? I mean,
Nothing.
You gotta be familiar with the diagnosis. If they're a code, if they're a full code or a do not resuscitate code. I mean, that's a huge deal too. Code blue, do we call code blue or not call code blue? I mean, that's huge. But anyways, after you get all that information down, you start going into the nitty-gritty details of that patient. So I like to start too with the IV. Do they have an IV? Where is it at? Their left arm, right arm, their jugular, their temple, maybe their ankle. Wherever it is, say where it is and what kind and what size it is, and if fluids are going. If there's fluids going, state what kind of fluids are going. Maybe there's antibiotics going. Maybe there's just normal saline going. Whatever it is, state what it is. Once you go from there, maybe there's no fluids going, so say that they're saline locked, and whether it's flushing okay, whether the IV is doing okay. Any of the assessment that you gained from assessing the patient, tell them about it. I almost forgot, you have to get the patient's history. This is absolutely critical. Now you don't have to go into a long story about it, but be to the point and any significant history. Maybe they're smokers, maybe they're drinkers, maybe they're diabetic, maybe, I don't know, maybe they have COPD. Whatever they have, make sure you tell that to the nurse because it's important to know the patient's history. Back to medications. You have to know their pain meds. You have to know if there's any scheduled medications that they have and the times that they have them. So that's also good. And what you've been doing with the medications as far as how much you've been giving them, if they've been refusing them or not. The next thing to cover and report is whether or not maybe they're a surgical patient. Maybe they had dressing changes, or maybe they're NPO for a procedure or a surgery that day. You have to relay that information. It is also critical, this is very critical, to alert the nurse that's coming onto the shift of the physician's orders. Maybe there's orders they need to acknowledge. Maybe there's orders they need to check. Maybe labs they need to check. So refer them back to the patient's chart so they can look through all that. And lastly, any important information throughout the day, any significant incident throughout the day, you should include that. Maybe they're angry, maybe they're yelling at you, Maybe they fell. Maybe they're incontinent. Whatever the story is, include what you think is important and what would benefit that nurse to better take care of that patient. Include it in the report. Man, I sure hope Trevor's ready to take a handoff from me, because there's a lot to cover and a lot to remember.
Wow, Dreamy, you're so smart. But anyways, we'll get Trevor's report and we'll get back to you.
Wait! One last thing. It is really important that right before you are done talking with the nurse for the shift report, to ask them, do you have any questions? Because that way they can ask any question they have about the patient and you can clarify it to them. Ask questions. Ask if they have questions.
Welcome back, everyone. I am now here with Trevor Potts, and we're going to ask him a few questions about his shift report experiences. Hi, Trevor.
Well, hi, Brittany. You sure look great today.
Thank you.
You're welcome.
We were just wondering how you get ready for your big handoff.
Well, last night I was really getting ready for the handoff. I went out with a couple boys, tossed a couple back, and I'm actually pretty tired, but hopefully Aaron just gives me a great handoff so I can just coast through the day, I don't really prepare for mine, I just go with the flow.
All right, well, what kinds of things do you like to include in your handoffs that you'll give to the next oncoming nurse?
Well, if it's a male nurse, I always tell him if the client's good looking, but, male, female. Sometimes I tell the doctor's name if I know the doctor. Most of the time I just try to not call him because I don't like doctors. But one thing I like to I like to include how much their urine output was. But really the only reason I can think of that right now is because I really have to go to the bathroom before this race. So thanks for your time.
Thank you, Trevor. That was a very interesting interview, but we'll hopefully get the further scoop on that later. Well, Aaron, I have another big question for you.
Oh, yeah?
Since all the commotion and all the excitement today of the big handoff, Jayco's here. How do you feel about Jayco being here at your big handoff?
Oh man, Jayco is super intimidating for all nurses. But at the heart of Jayco, they are concerned about patient-centered care. So even though we as nurses are afraid of them, they're actually a good organization. Handoffs are an integral part to the nursing process. And Jayco believes so firmly in this, they established a definition.
Wow.
A definition, yeah. A process in which information about patient, client, or resident care is communicated in a consistent manner. That is the definition that Jayco has come up with for handoffs.
Wow.
Based off of that definition, Jayco has given recommendations to nurses as a whole to help guide their report. Those recommendations include clear language. So talk in language that they're going to understand, not terms way above their head or slang terms that people would use that aren't educated. We're educated. We're nurses. Also, have a standardized shift-to-shift or unit-to-unit report. This is more based on the facility to have a standardized level of report, a way to give report.
Of course.
But you personally, as a nurse, can have a standardized way to give report. Give report in the same way every time so it's ingrained in your head. And if be open to suggestions. Ask the nurse, was this report good, or can I add some things or subtract some things that are needed? Also, use effective communication. If something is important, stress that is important. If it's not important, don't go on elaborating about it. Also, it's good to use technology, the computers, the electronic charts, to help you give report. Give report at the computer so you can refer to labs and you can refer to doctor's orders. Technology is our friend as nurses. We should use it in giving shift report.
Of course. Thank you, Aaron. That was so good.
Yeah.
Jayco, we are so privileged to have them here today, and they are going to have great reviews about you guys. Thank you so much.
Thanks, yeah.
So, Trevor, I have a couple more questions for you.
Okay, what's that?
Oh, Jayco's going to be here today. With all the commotion and everything that's going on, how do you feel about Jayco being in the presence of your big handoff?
Jayco? Who's
Jayco. Like the Joint Commission?
Jayco? Oh, I thought J. Lo was gonna be here. Wow, I don't even know if I want to run anymore. They might make me quit or something. I don't know. I don't know if I can handle this. Just kidding. I can handle it, even if J. Lo's not here.
All right. Well, again, another interesting response from Trevor Potts. I guess we'll get back to you on more with that. All right, Aaron, I have another big question for you.
Okay.
What do you feel are some of the biggest barriers when doing shift reports?
Oh man, the top 5. The top 5, according to the survey I conducted, the top 5 biggest failures to shift change are too many stories, too much history, too much opinion, they're in a hurry, and they don't tell you about the significant events that happen throughout the day. Too many stories. Don't go on talking about stuff they don't need to know. It's important. If it's important, include it. If it's not important, that's not going to help the nurse take better care of this patient, don't include it. Too much history. They can look on the computer for the history. Only include what you would want as a nurse to help take better care of this patient. Again, only include the basics. They can go back to the computer. Don't use so much personal opinion. Be objective, not subjective. So many times I've gotten report from nurses and say, this patient is cranky, this patient is angry, this patient yells. And I go into the room and the patient's smiling. Maybe instead say, this patient has had a difficult day. This patient has been agitated throughout the day. But don't include personal opinions. Be as objective as you can in both your charting and your report. Don't be in a hurry. I know you want to get home and get some sleep or do whatever you want to do after you're done with work. But take your time, because this is probably one of the most important parts of the nursing job, giving report. The last thing too is significant events. So many times a significant event has occurred throughout the day and the nurse doesn't include it. And sometimes that doesn't come up on the chart. Sometimes they don't include that in the chart. So include significant events that happen throughout the day concerning the patient's status.
Well, hello again, Trevor. I have another good question for you. Through all your nursing time, what do you feel is the biggest barrier when doing a shift change?
Well, the only barrier I can think of off the top of my head is they don't give shift report fast enough. They're always trying to tell me all this important things. I don't care. I mean, all I gotta do is give them meds and get out of there. So that's my only answer is they can't give it to me fast enough.
Okay, and with that information, giving it fast enough, did you survey that, or how do you really know that's true?
I just know. It's me. I'm always right. I just know. Okay. I'm done with questions. Thank you.
Well, there we have it, folks. Another interesting answer from Trevor Potts, RN. Thank you so much for listening. All right, everyone. This is it. This is the big moment. We're getting very close to the big time and the big handoff. And Trevor, he's again very interesting. What is he doing? We're not really sure, but again, we'll get back to you and find out. Stay tuned for the big handoff.
Let's get ready to rumble!
But fellow nurses, it's important to remember that it's not just one person that's involved. It's a team effort. That is what makes the perfect handoff.
Welcome back. Well, that was quite interesting. I especially enjoyed the surprise visit from Jaco and how they handled that pressure, as well as the short shorts. Those are some special nurses who will forever remember this day. And to recap, let's look at the 4 leadership skills that highlighted this event: organization, goal-oriented, communication, and assertiveness. Without these skills, it is clear that handoffs cannot be successful, as demonstrated by Aaron and Trevor in that live presentation. For example, Trevor was clearly distracted by our lovely Brittany and neglected the key skill of goal-oriented. Had he been more aware, like Aaron, this handoff would not have been a failure. There can be many barriers to handoffs, but being aware that they exist can help all nurses prevent miscommunication and protect the patient. That's all for tonight, folks. I hope you enjoyed this broadcast as much as we have here at KICK.